Hi everyone, welcome back to my channel Mommy's Nursing Care. Today I'm going to discuss about nutritional requirements in infants. Infants we called it as like from birth to 1 year. After delivery of the baby out of the mother's womb, we can call that baby as infant, still 1 year. So actually the fetus, that means when the baby is inside of the mother's womb, we can see that the growth of the baby is very fast. Even after coming out of the mother's womb also, baby's growth will be very rapid. Baby's growth will be very rapid. During this phase, babies require excessive nutrition. That means like specific nutrition they require for their growth and development. So what specific nutrition that we have to give? Nothing but the breast milk. Breast milk is, I should say, the divine gift of God to the baby from the mother. So every drop of the breast milk is very valuable because it is having all the nutrients that baby requires. So for at least 1 to 6 months, every mother should give breast milk to the baby because this breast milk contains protein, fat, and all the nutrients, minerals, vitamins. So these are all the required for the growth and development of the baby. Not only that, this breast milk is having also contains like immunoglobulins and enzymes also. Especially after delivery of the mother, for the first 1 to 3 days, the milk won't produce. Milk won't be produced. So instead of milk, first producing thing is colostrum, that is a bit yellow color and thick fluid. Immediately after delivery of the baby, the mother should feed to the baby immediately after delivery, because after delivery for 3 days colostrum produces. This colostrum is very much important and it is having immunoglobulins IgA and IgG, which are very helpful for the baby to fight against the infections. So the baby's immunity is not developed. That means it is not well matured. I should say that it is not at all matured. So before maturing of baby's immunity, this colostrum is having the power to fight against the infections like poliomyelitis and tuberculosis and etc. So we should give the colostrum. So this is very important to give the colostrum to the newborn baby. So especially in the tribal area and the in illiterate people, what they will think that this colostrum is like it is not milk and it cannot be digested by the child. It is not actually the fact thing. The fact thing is the colostrum is very good for the baby, that gives the immunoglobulins and enzymes. These enzymes are very much important to cell maturation. That means those are all the organs, those are containing cells. Those can mature with this help of colostrum. After colostrum production, the milk will started producing. Milk will started producing after 3 days. So there is no hurry for the mothers to watch for the milk. So milk contains protein, fat and carbohydrates. Protein, fat, carbohydrates and all the remaining nutrients. Those are very helpful for the baby. The mother should feed the child with breast milk at least for 4 to 6 months. Other than breast milk, she should not give anything to the baby. And while giving breast milk also, see that the baby's mouth should have all the nipple. That means not only the tip of the nipple, all the black area that is surrounded by the nipple, all that black area should go into the mouth of the baby. By that it maintains the good latching or good sucking. and baby won't be struggling to suck the nipple. It will be very easy for them to suck, and also it avoids the chances of aspiration of milk into the lungs also. So that is the good latching technique, that nipple should go along with the surrounding black area also into the mouth of the baby. There are lot many benefits in giving breast milk to the babies. Among all, few of things let us discuss. The first and the foremost thing with the breast milk advantage is it is having immunoglobulins. Immunoglobulins are like IgG and IgA, which can help the child to fight against the infections. And the remaining thing that we discuss means it is having all the nutrients we can see from here: water, protein, carbohydrates, minerals, protein, water, vitamins, minerals, various fats, antibiotics, hormones, other immune cells. There are many things are there in the breast milk. So in case in the bottle milk this won't be there. And the another thing is the breast milk is sterile, that you need not to boil the bottle and then again preparing the bottle feed. It is time taking process. It doesn't want any extra time, and the breast milk considered as a hygienic thing because it is directly coming from the mother's breast. So we consider the breast milk is the hygienic one. And not only that, from the side of the baby, the breast milk are having many benefits towards the mother also. In case of bottle feed, we'll have to take care of the bottle also. Bottle should be sterilized and everything should be cleaned very perfectly. And then in sterile manner only, means like after following the aseptic precautions, then only we can prepare bottle feed, because we consider this is a sterile process. Because in case if any bacteria that enters into the children's stomach, that causes the botulism, that is a serious diarrheal disease. To avoid this all the things, the breast milk is the best thing. Why? Because the breast milk we consider it as a sterile. Yes, it is, the breast milk is sterile. So see, if we give bottle feed, another disadvantages of this bottle feed, there is no bond between the child and the mother. Bottle feed could be given by mother, father, anybody can give bottle feed. They'll just prepare and give it to the baby. But whereas the breast milk, it brings a good attachment to the baby and mother, a good relationship bond. It develops a good bond between the mother and the baby. That's the breast milk's another importance. Instead of giving bottle feed, it is better to give the breast milk. Not only that, see, if we give breast milk, see how the attachment develops. It really develops very well, the bond between the mother and the baby. Here you can see the picture. Not only for the from the baby side there are the advantages of the breast milk, from the mother side also there are many advantages of giving breast milk. The first and the foremost thing is, if you give breast milk to the baby, the uterus, enlarged uterus, it comes to the normal level. How it is, see how you can see from the picture how it is coming from the above side, from the above the umbilical cord to the normal level. So by the 8th week of the mother, after delivery, it will come to the normal level. When we give breast milk to the baby, the involution takes place. That means the normal size of the uterus will be taking place normally and as soon as it is possible. And besides that, not only that, if you give breast milk to the baby, there is a less chances of developing breast cancer. The scientists, from their research, they found that those mothers mothers they did not feed the children, or those are nulliparas, are having the more chances of getting breast cancer. So there are less chances of breast cancer if you give breast milk to the baby. And another advantage here is, if you give breast milk, what happens, it is acts like a natural contraceptive. You need not to take any medicine for the, at least for the first 3 to 4 months, to stop your pregnancy, because you are already feeding your baby. So the prolactin is producing prolactin, which suppresses the pregnant producing hormones, so that you won't be getting pregnancy also. It acts like a natural contraceptive also. These many benefits are there from the breast milk. So so I suggest you all to give the breast milk to your babies after listening to this class. Thank you very much. So thank you for watching, and please subscribe, like and share my channel. Those who are mothers, this is an informative video that you can share with all the parents, and it can give them the good